everybody, Dr. Coyle coming to you live from the Coyle Institute here in Pensacola, Florida. And today I have something very exciting to be able to share with you guys. I'm sure you guys have heard about the ozone layer, right? And as well as, I don't know if you have really noticed it, but if you've ever been, outside shortly after a lightning storm, you may have noticed a fruity smell. Well, that's ozone. Ozone is O3 as opposed to oxygen, which is O2. Ozone is extremely powerful for multiple different issues that a lot of us struggle with and deal with. Ozone was first discovered back in the 1700s, and then in the 1800s, it was actually used in medicine as well as dentistry. And then in the early 1950s, we were able to make an ozone generator. So we simulate that lightning storm that creates that ozone, that fruity smell. And so basically what we do is we take oxygen, put it through this ozone generator, and ozone comes out on the other side. And so since then, since the 1950s, we've been using ozone for many different things in the body, specifically things that are, that we need to boost the immune system. So if you're currently struggling with any immune system issues, autoimmune disorders, chronic infections, chronic illnesses, things like cancer, anything that decreases your immune system, then ozone is very powerful for boosting up that immune system. In addition to that, ozone has also been used for local areas, for like injections. So a very amazing doctor in Nevada, Dr. Schellenberger, invented a technique called the prolozone. And what it does is it uses an injection and uses ozone. And so if you're currently struggling with knee pain, back pain, elbow pain, neck pain, anything like that you would normally get a steroid injection for, well, we can use prolozone to actually inject those areas to try to decrease that inflammation in those local spots. Got a very special thing for you today, because I actually have a patient that has agreed to give us a little historical about her. She's been receiving the ozone therapy, and so she's going to tell you a little bit about her story, about what she was going to go through and how things have been going. And she is going through what we call MAH, which is, and you'll see a little sign at the end of this video. And MAH is a way of really treating that whole body. So people that are struggling with autoimmune disorders and things like that, it is absolutely fantastic for dealing with the whole body. And so you'll see her pictures and then kind of go from there. And so very excited to be able to offer this to all of you guys. If you have any questions, any concerns, don't hesitate to give us a call here at Coyle Institute, and we'll be happy to answer those questions for you. And I hope to see you here for your ozone therapy and get you back on the road to recovery and feeling a lot better. Hello, we're gathered here today, not to get married, but no, anyway, we're gathered because we have a patient here that has been going through ozone therapy. And ozone therapy is basically where we take ozone. It's actually called MAH. And so what we do with that is we are going to draw some blood from her, and then we take ozone, and then we put the ozone into the IV bag, and then we take her blood with the ozone mixed together, and you'll see some pictures of like before and after the ozone. And then place that ozonated blood back into her body. So basically, she's just, giving some of her blood, we're ozonating it, and then putting it back inside the body. I am going to have, a whole bunch of other stuff as far as the benefits of ozone therapy. This has been around for a very, very long time. It was actually first discovered in the 1700s and was used in the late 1800s for medicine and for dentistry. And really in the 1950s, we came out with a ozone generator, which made it a lot easier to be able to get some of the ozone. Ozone, as we all know, we have the ozone layer above, but we also, whenever you have a storm, a lightning storm or whatever, and you have that fruity smell afterwards, that's ozone. So ozone is completely natural, and God made it, and it's just one of those things that we have, but we have found that hyperoxygenating the body can actually help heal the body. It can help heal all kinds of things. And so I wanted to ask, before we started doing the ozone, so this will actually, she's had 4 ozone therapies at this point. So before doing the ozone therapy, tell me what your life was like.
Well, I had a lot of inflammation in my joints. I had reached a point where I was not able to really get around very well. Just a lot of arthritis pain in my joints. And that was the biggest issue that I had. I was having trouble walking. Sometimes I was having trouble doing simple things because of my hands and my shoulders, like brushing my teeth and really just even getting out of bed.
Okay, wow. And we started doing the ozone. How are you feeling now?
I feel fantastic. I really do. I noticed a difference with the very first treatment. It didn't solve everything 100% the first time, but the subsequent treatments have just really helped. It seems like one does build on another, and I can, form fists. I can get out of bed. I can brush my teeth. I have noticed a huge difference.
Yeah, you were telling me last time, so before we did your treatment last time, you hadn't been able to really walk very far, but the day before coming in here, you actually had walked a mile.
Yes.
And the day of, that morning, before your ozone therapy, you had actually walked 2 miles.
Yes.
And you hadn't been able to do that for months, right?
Almost 6 months.
Wow.
Yes, and I'm still walking.
That's
yes.
Fantastic.
Yeah, and there's an overall sense of just feeling better. I noticed that with the treatment. I just overall feel better, which is, just an extra benefit in addition to the fact that my joints are moving now.
Okay, fantastic. Well, I appreciate you. I appreciate you being here. I certainly, we're going to have, step-by-step kind of things, but, if, as far as having the ozone therapies, was it painful? Was it, really rough to go through?
No, it's not. I think being hydrated before the therapy is very important.
Yes.
But for me, it hasn't been painful at all. I mean, I haven't had any after effects that were negative.
Okay, great.
It's quick, it's easy.
Basically it is getting an IV, and so, we do start an IV on you, but other than that, you haven't had any, side effects, anything crazy?
No,
oh, good.
Nothing at all.
Well, and it's amazing because, your body, it's so funny as we talk about, you can go months without eating, you can go weeks without drinking, but you can't go but a few minutes without oxygen, and so hyperoxygenating the body to kind of, really target those areas that are very high in inflammation, irritated and stuff like that. So there are many different reasons for using ozone. Those are all going to be listed for us, but I just wanted to thank you for your time today, and we're going to go ahead and get started with your 5th ozone therapy today and go from there.
Perfect. Anything
that you would like to tell anybody?
I wouldn't be afraid to try this if you have something that's listed in the conditions. It is really painless, and just personally I've benefited from it. So it's not something that I haven't tried that I say to go and do it. I mean, I pretty much stand behind it.
Perfect. Well, thank you. Well, thank you very much. I appreciate you. Thank you.